So when you look at our disease patterns in the US today, we've had a shift. We've gone from a time when acute disease was the major cause of death to a time when chronic disease is the major cause of death. And the challenge there is the problems that we have now, diabetes and heart disease, no one, neither public health nor medicine alone, can defeat these challenges, because these are problems that originate outside of the clinic walls. We've gone from a time when there were biological, physical, and biological origins of disease to a time now when there are actually social and environmental origins of disease. And it's not as simple to treat those. It's not a pill. And this is further complicated by our lifestyles. There was no one who ever really wanted you to get syphilis. No one benefited from that. But now there are corporations that if we don't buy guns or smoke or eat a high-calorie diet, it impacts their bottom line. So there's a lobbying interest to keep us kind of making choices that aren't always the best for us. Primary care and public health together can work towards a community where health is the best choice, the default choice. And that's where we have to go. But we're only going to do this if we work together. Otherwise, we're going to continue just to kind of treat our individual problems in our silos, which won't actually change anything. So when you think of primary care and public health together, there are three areas where integration, collaboration, partnership could be easily achieved and would be a very powerful change agent for health in our communities. One is data, and that's data for the public health department, getting the outcome data that they need from the EHR, the electronic health record, and for primary care, contextualizing the data that they already have in their EHR. So data, extraordinarily important, and one place that we all can work together. Aligning health messaging. So if we know, working with our primary care providers and our public health leaders, that there's an asthma problem in our community, then let's really align. Let's make sure that every billboard is talking about asthma and that every clinical encounter talks about asthma. Think about how powerful that 1-2 punch would be in a community, and it could really change behavior. And lastly, it's policy and environmental change. The number of challenges that are the health challenges that we have that originate because there's not a policy that protects us or there's an environmental irritant. Take something, for example, there was research that showed that if you pass a alcohol outlet on your way to school, you're more likely to experiment with alcohol as a teen. We couldn't make a policy to prevent that. But policy development takes a lot of things. It takes stories and information from the clinical provider that can fortify the quantitative data that we have on the public health side. And together, we'll be more effective in making policy than if we try to do it alone. And for the primary care folks, I mean, going to the legislature on their own, they may be less effective than if they actually partner with the public health department and get the community level data that they need to make a very powerful case. Good policy action is good stories married with good data. And that's how you change policy. And we can only do that if we're working together.